What is liver cirrhosis? Causes and symptoms of liver cirrhosis. Hello and welcome back to our channel. I am Dr. Neha, a liver specialist at Bharat Homeopathy. Today, I'm going to discuss an important topic that affects millions of people worldwide. Liver cirrhosis. Yes, in today's video, I will explain to you what liver cirrhosis is, its symptoms, causes, and holistic homeopathic treatment. I will give you scientific details based on research and my own clinical practice. So stay tuned and don't miss a single minute of this video. Let's begin the video with what liver cirrhosis is. See, the liver is one of the most vital organs in our body. It is often perceived as the second brain because it regulates several vital functions in our body. Your liver helps detoxify your blood, produce bile for digestion, and play an important role in regulating your blood cholesterol levels and blood sugar level. And one advantage that comes with your liver is that if it gets damaged, it tries to repair itself. I mean, in short, if I say the liver can regenerate itself. But how does the liver damage happen? Liver damage occurs when the liver is repeatedly exposed to several toxins from, for example, excessive alcohol consumption or infections. Over time, your liver tries to repair itself, and this repair process can lead to the formation of scar tissues. This scar formation is called liver cirrhosis. As cirrhosis progresses, more scar builds up on your liver, and this disrupts the normal liver function. If this condition persists, it can eventually lead to liver failure. Well, liver cirrhosis is a chronic liver disease. It takes time to develop, and even during its primary stage, you will not observe any major symptoms, and sometimes it may go unnoticed. Alright, I have explained to you what cirrhosis is. Now, let's discuss the stages of how it develops and what happens to your liver at every stage. See, liver cirrhosis has two stages. Stage 1 is called compensated liver cirrhosis and stage 2 is called decompensated liver cirrhosis. Let's first discuss what compensated liver cirrhosis is. In compensated cirrhosis, your liver is still able to function properly. You will not notice any symptoms during this stage. Even people who are in this stage may have a median survival time of more than about 12 years. Now, let's talk about the second stage, which is decompensated liver cirrhosis. In this stage, your liver stops functioning properly and further liver complications can develop. For example, jaundice, ascites. It's a condition where fluid builds up in your abdomen. Hepatic encephalopathy, where toxin starts building up in the brain, causing tiredness, confusion, etc. Well, people with decompensated liver cirrhosis have a median survival of about 2 years. This stage of liver failure and a patient require immediate medical intervention to avoid any fatality. Alright, ignoring your liver problems is not an ideal pursuit of living a healthy life. You will be surprised to know that liver disease is the 11th leading cause of death worldwide. If I tell you the global data of people with chronic liver disease is about 1.5 billion, which is a huge number. Only 4.5 million adults in the US, or you may say about 1.8% of the population, have chronic liver disease. I know this number is no less than a nightmare for you, but don't worry. Liver disease can be reversed if proper and timely treatment is taken. Now let's discuss the causes of liver cirrhosis. Before I begin, I want to remind you that if you have any liver problems due to the following causes, it is important to talk to your doctor or the healthcare provider right away. The first and the foremost cause is prolonged alcohol consumption. Excessive alcohol consumption can severely affect your liver functions, resulting in cirrhosis or liver failure. Your liver breaks down alcohol, but when too much alcohol is consumed, your liver becomes overloaded and unable to process it effectively. Subsequently, it can cause liver inflammation or scarring. Now, if I come to the second leading cause of liver cirrhosis is non-alcoholic fatty liver disease. Yes, non-alcoholic fatty liver has no link with the consumption of alcohol. This condition occurs when fat starts accumulating in your liver, making it inflamed. Non-alcoholic fatty liver is linked with type 2 diabetes, obesity, high cholesterol, and certain metabolic syndromes. This condition can turn into liver failure if left untreated. The third cause is hepatitis B and hepatitis C viral infections. These viral infections targets the liver and cause inflammation if left untreated. Well, between the two types of hepatitis, hepatitis C is more dangerous for you as it often has no symptoms until significant liver damage happens. You will be surprised to know that 1 in 4 people with hepatitis C develop cirrhosis. This is a huge number that may raise a concern. Well, the fourth is the use of certain medications and substances. For example, OTC, over-the-counter drugs, NSAIDs, non-steroidal anti-inflammatory drugs, anti-malarial drugs, etc. can damage your liver functions if used for a long period of time. Again, these medicines can interact with your liver enzymes and slow down the liver functions, resulting in liver failure. Certain genetic disorders can also cause liver cirrhosis. If your parent or anyone in the family has or had any kinds of metabolic disorders, then you may inherit the disease from your parents. Genetic metabolic disorders like hemochromatosis, it's a condition marked by excessive iron deposits in the liver. Wilson's disease, which causes excessive copper accumulation in the liver. These inherited metabolic disorders can cause metabolic imbalance in your liver, causing hepatic cirrhosis. Well, let's talk about the sixth cause of liver cirrhosis, which is autoimmune hepatitis. Yes, immune dysfunctions of your body can also result in cirrhosis. This happens when your body's immune system mistakenly attacks your liver cells, causing inflammation and eventually long-term damage. Well, I hope you would now have a better understanding of how liver cirrhosis can occur. Now, I will discuss how you can identify whether you have liver cirrhosis or not. I mean, what symptoms you can observe in yourself if you have cirrhosis. Say, cirrhosis is usually asymptomatic during its primary stages, but when it progresses, you eventually experience symptoms. Well, nonetheless, I will discuss what symptoms you can notice. You may feel extreme fatigue. Your liver is unable to regulate all the vital functions in the body, thus making you feel tired and weak. You may also feel nausea and loss of appetite as your liver is unable to produce enough liver enzymes and remove the toxins from the blood. If you have cirrhosis, you may notice itching. This can occur due to accumulation of bile salts under the skin. Swelling in the legs, swelling in abdomen, as I've already told you, ascites, swelling in ankles can also occur if you have cirrhosis. Yes, because your liver loses the ability to regulate body's fluid balance. This fluid can accumulate in the legs, abdomen, ankle, causing them to swell. You know, people with cirrhosis also notice bruising and bleeding easily. Yes, bleeding is usual in cirrhosis as your liver is unable to produce enough clotting enzymes. Jaundice is basically yellowness of your skin and eyes. If your liver is unable to process and remove the bilirubin, which is produced when your liver breaks down old red blood cells. Now, if you suspect that you have any of the listed symptoms, then I must advise you should consult a liver specialist today itself. Early diagnosis and treatment can guard your liver from further damage. See, liver cirrhosis can easily be managed with homeopathic medicines. I've seen many patients who were earlier taking treatments from many doctors, but when they approached me, I've done a complete analysis of their cirrhosis, offered them a customized treatment based on their constitution and their symptoms. Now, after taking our medicines, they noticed an improvement in their liver condition within just few days. We have won the hearts of people because we believe in treating a patient as a whole and not symptoms. Homeopathy does wonders in treating liver patients, and we have a strong record of positive patient feedback. If you want to say goodbye to your liver cirrhosis, then call us on our number and begin your treatment regime today with no side effects and no bitter pills. If you found this video helpful, don't forget to like, share and subscribe to Bharat Homeopathy YouTube. Stay healthy and take care of your liver. Thank you.